What is proximal weakness in muscular dystrophy? Imagine trying to lift your arms or stand up from a chair, but your muscles just don't cooperate like they used to. That's often what happens with proximal weakness in muscular dystrophy. This type of weakness mainly affects muscles close to the center of your body, like those around your hips, thighs, shoulders, and upper arms. These muscles are crucial for everyday movements such as climbing stairs, lifting objects overhead, or even getting out of a chair. When these muscles weaken, these simple tasks can become challenging or tiring. Proximal weakness happens because of genetic changes that cause muscle fibers to become damaged and waste away over time. This process is called muscle atrophy. In muscular dystrophy, the damage is ongoing, leading to a gradual loss of strength. The term proximal helps doctors distinguish these muscles from distal muscles, which are farther from the center of the body, like those in your hands and feet. While distal muscles can also be affected in some types of muscular dystrophy, proximal weakness is a hallmark feature, especially in conditions like limb-girdle muscular dystrophy. People with proximal weakness often notice difficulty doing activities that require core and limb strength. For example, they might find it hard to lift their arms overhead, stand up from sitting or lying down, or climb stairs. In more severe cases, even sitting up from a lying position can be a struggle. Usually, this weakness affects both sides of the body equally, making movements unsteady or less controlled. Diagnosing proximal weakness involves a detailed medical history and physical exam. Doctors look at muscle strength and how well the muscles function. They may also use tests like electromyography, which measures electrical activity in muscles, to help determine if the problem is within the muscles themselves or related to nerve issues. Imaging tests such as magnetic resonance imaging can show patterns of muscle damage and help identify the extent of muscle wasting. While there is currently no cure for most types of muscular dystrophy, early recognition of proximal weakness is important. Treatment focuses on maintaining mobility and independence through physical therapy, occupational therapy, and assistive devices like braces or walkers. Managing symptoms early can help improve quality of life and slow down the progression of muscle weakness. In summary, proximal weakness in muscular dystrophy refers to the gradual weakening of muscles near the center of the body, impacting core movements and limb function. This weakness reflects ongoing muscle degeneration caused by genetic factors. If you or a loved one notice difficulty with everyday activities involving these muscles, it's essential to consult a healthcare professional for proper diagnosis and supportive care. Remember, each person's experience with muscular dystrophy can be different, so personalized medical advice is always key.